I kind of come from a medical family. My mom's a nurse and my father's an oral surgeon. I went through dental school, and so I kind of always knew I wanted to be a doctor. But what kind of drew me into the neurosurgery and the surgical specialties was when I was on service and actually saw a very, very sick patient who came in. I was very junior at the time, thought the patient was going to die for sure. And these surgeons, these neurosurgeons, were just so confident. They knew what they were going to do, and they quickly handled the situation and performed a pretty invasive surgical procedure. And we saw the patient back in a couple of weeks. The patient was normal and doing fine. So seeing how some very sick patients can actually do very, very well with good surgical care is really what drew me into the field. My strength is obviously, interacting with patients and teaching them about what we're potentially doing. But the biggest strength I have is being in the operating room and taking care of people. So about 50% of my practice is emergencies when patients come into the ER and the neuro ICU, and then another 50% of my practice is outpatient. But we usually have to follow people for at least a couple of years afterwards. Patients that come into the ICU, tend to be very sick, and those patients need a lot of follow-up. And typically, it's sort of a long-term relationship I have with the patient. When you do neurosurgery, and especially the type of neurosurgery that I do, which is cerebrovascular neurosurgery, these patients can be very, very sick when they come into the ICU or into the emergency room. But it's really, getting them through, nursing them through that hard time that they're going through in the ICU, and then seeing them 6 months or a year later walking in, smiling and looking totally different. That's absolutely the best thing about what I do. So what free time I have, I usually spent with a family. So I have a wife and 2 kids. Hobbies I have, one weird hobby is I like saltwater reef aquariums, and so I have a pretty elaborate setup where I take care of a bunch of fish and corals and things like that. And the other thing I do is I'm a long distance runner, and by long distance running I mean I run 50 to 100 mile races once a year. So a lot of running and a lot of training for those. So that pretty much takes up all my time.